A very good morning to you. Now, I come from the state of Bengal, and in Bengal, we worship Ma Durga, Rabindranath Tagore, and intellectualism. And in order to look like an intellectual, you need to wear glasses, very thick glasses. So in a situation like that, doing refractive surgery, counseling a refractive patient is indeed like selling ice to an Eskimo. My father was a doctor, a physician, and I often watched him tell his patients when they asked too many questions, "Are you the doctor or am I the doctor? Trust in me." Today my patients ask me, "Okay, doctor, you want me to do silk? Is that even FDA approved?" So the age has changed, the time has changed, and counseling is very, very important, especially when you're doing it to a refractive patient who can live with glasses. It's an elective surgery. What's the aim of counseling? First and foremost, most of our patients who come to us come because they need, it's mainly career-oriented. They need a job, they want to join the army. Those patients are easy to counsel. But the ones who have been living with glasses for a very long time, don't know whether they really want to get rid of it or not, these are the patients whom you need to explain that with getting rid of glasses or doing refractive surgery, your dependency is going to improve. And what I tell my patients is that at this moment, if your glasses were to fall down and break, you would be as blind as a bat. But at the same time, you need to be very, very honest. You need to tell the patient, and the patient will often ask you, "What guarantee do you give me? Or will I get 6x6 vision?" What I tell my patient is that, look, I cannot give you a 100% guarantee. Even if you have a 6x6 vision, there is no guarantee that it will not become less. Because at the end of the day, I am not God. And that somehow appeals to the patient. Explaining the procedure is very, very important. Do remember there is a bigger doctor out there, a doctor by the name of Dr. Google, and now we have artificial intelligence to add to it, and so your patient probably knows much more than you do. So explain the thing. Do not treat him as someone who's dumb or dark in the dark. If you have a model, use it. I use my iPad to show them the procedures. So show them all the procedures, explain all the procedures, tell them why you think silk is better than LASIK. Benefits, of course, there's a high success rate, but I'll be repeating myself, and I cannot repeat this enough. Do not tell a patient that it's going to be 100% successful. Patients will come to you with 6/9 vision and then expect it to be 6/6. You cannot give that. And believe me, there are, with the media, with the social media, you have so many people claiming that they can do that it's really, you're on the back foot while counseling a patient. However, do explain to the patient the freedom that they will have after that they have done the refractive surgery. Benefits, of course, there are some benefits which is there for everyone to understand and see. You have a better lifestyle. Who likes to wear something heavy sitting on the noses? Sports, this is an absolute necessity for sportsmen. Swimmers, they can't swim with their glasses on. Professions, certain professions, and more of these professions now demand for refractive surgery. Very recently, NASA has said that you need to do refractive surgery and get rid of your glasses. The Army, the Navy, the Air Force, railways, they're all asking for it. Risk. You cannot keep stressing on this. Dry eye, yes, it is a side effect. It's not really a risk, but do explain to the patient that you'll be giving them lubricating so you can deal with the dry eyes. Halos and glares, you need to be very honest about it. All of refractive surgery causes some amount of halo and glare, and if the mesopic pupil is large, then there's every chance of the patient having that. Explain to him and teach him how to deal with this. Infection, very, very rare, but it's not that you cannot have it. You can always have that. Ectasia, again, if you're on the safe side, if you are, like me, a surgeon who likes to play safe, it usually does not happen. Undercorrection, overcorrection, no guarantee against it, so explain to them that there can be enhancement surgery. One thing that you really need to explain is presbyopia. Tell the patient that yes, if you're doing it at a young age, there will come to an age when you will need glasses. This is aging process. I cannot do anything about it. Preoperative instructions, well, you need to tell. you need to tell the patient that you have to get rid of your contact lenses, and it's better that you tell them on the very first day of counseling. Also, post-operative instructions, it's always better to tell them about the eye protection. The activity restriction is something that you really need to stress, because patients want to go to the gym the very next day after doing a LASIK, or they want to go swimming, or they want to train for the army. So you need to tell the patient the very first day that there is going to be a certain amount of time, maybe 15 days, maybe a month, where you will have to restrict your activities. Encourage questions. Please, unlike my father, do not tell the patient that I am the doctor and you are not. You have to answer all the questions. If the patient does not ask you questions, you ask the questions yourself. Clarify everything and give as much in written as possible. Conclusion, counseling, a good counseling builds up trust, and believe me, it gets rid of all the sleepless nights you have when you land up in a fix after surgery. And as every refractive surgeon will tell you, doing refractive surgery is really an act of bravery, because you're touching an eye that usually has 6x6 vision. So do not bring in a headache after surgery. Take all the headache that you need to take prior to the surgery. Spend time with the patient before the surgery so that you have to spend less time afterwards. Thank you for a patient hearing.
Very nice one. I think you have covered most of the points very well. And counseling is the key of refractive or any premium surgery. If your counseling is good, you are going to be happy afterwards. Doing surgery is one thing, but giving a proper counseling is very, very important. And as you have already said, never overpromise, do underpromise. And I tell most of my patients that this surgery is for reduction of number. I never say it's for removal of glasses. So even if you're writing in your prescription, write advice surgery for reduction of number. Then you are also safe, and you are not over promising anything. Thank you.